Hi guys, welcome. My name is Jaco from Health Pro and today we're speaking to Labarre, who is a biokineticist.
Yes.
Hi Labarre.
Hi, how are you?
I'm great. How are you doing?
I'm good, thanks.
Brilliant. Labarre, today we'll be discussing something that you're quite passionate about, amputees.
Yes, yeah. No, I am. I think it's something that very few people actually do in our region where they focus on. And I think it's patients that need a lot of help and long-term help that they're not actually getting at the moment.
I agree with you. It's something that I rarely hear about
Yes.
or anyone talk about. And
Mm.
again, there are people that struggle with it.
Yes.
But let's start off with who is an amputee?
Yes. Okay, so an amputee is anyone that's had an amputation. So the surgical removal of any part of the limb. So it can be upper limb or lower limb. Let's focus on lower limb because that's mostly lower limb amputations what we see around here. You get anything from the foot, it's maybe a toe amputation or the front part of the foot, so it's transmetatarsal, or we get below the knee, you get through the knee, we get transfemoral, which is just above the knee, or like a hip disarticulation where the amputation is actually through the hip joint, which is obviously the most severe amputation. So that's the type of amputation that we see.
Wow, and what is the causes? How do people get amputations?
Okay, so there are a few causes, but the four main ones is diabetes. A lot for the lower limb amputation population is diabetes. Then any tumor or cancer can cause an amputation. There's obviously the trauma, so car accident, motorcycle accident, and then birth defects sometimes result in amputees.
Yes. We know of quite a well-known amputee that actually had amputations due to birth defects.
Exactly, yes.
Right, and interestingly enough, you as a biokineticist will treat people through exercise therapy. How do that apply to working with amputees?
Yes, okay, so obviously when a patient is in the hospital, the surgical amputation happened, sometimes they get physiotherapy in the hospital setting. So there's some exercises that happen there. Maybe they get the prosthetic leg if they qualify for one, because they do rate you. And then they get sent off home. And they never actually pay any attention to actually making sure they're strong enough to use that prosthesis well enough, or actually take care of the other leg. Because if you're a diabetes patient, you should be taking care of the other leg to make sure that doesn't happen on that leg as well. So for us, rehabilitation is really, really important, not just to get your function back, but to make sure that it's movement of good quality and that you can sustain good movement. Things like picking up an object off the floor, or can you balance on your good leg while you're actually putting the other prosthesis on? Can you sit down well? Can you stand up well? People aren't strong enough to do that, and they think that's normal. They think it's fine if I'm in my wheelchair and I can carry on like that, or they think it's fine to just be able to walk with two crutches. They think they don't need to go back to their normal function, and that's why we're here. We really try to get people back to their normal function.
That's something I hear a lot where people will tell me, listen, I got a prosthesis or prosthetic leg after the procedure, but I haven't used it in 10 or 15 years.
They call it a closet one, it's there in the closet. I still use my wheelchair, it's there.
Yeah, so it seems like it's quite a big problem. Take us in depth a little bit. How would a treatment look if you apply a treatment to a patient?
So obviously, I can't treat you if I don't know what your abilities are. We can only measure, or we can only treat what we measure. So the initial setting, we obviously evaluate the patient as in any other patient. We test your abilities. We see what you can do, what you cannot do. Sometimes we use a test called, or a scoring sheet that is called the Ampno Pro test. And this is specifically for people with a prosthetic leg or prosthesis, or without one that doesn't have one yet. And according to that sheet, we score you, we actually see where you are. Can you, like I said, pick up something? Can you stand? Can you handle a little nudge, According to that, we see your strengths. Maybe you're really weak in the upper body, and then we know that's something we need to work on. So after your evaluation, we get to the rehabilitation part. And that's where you maybe come in once a week. It differs from person to person, but maybe you come in once a week and we actually do a whole exercise session in the practice. We work on upper body strength, we work on lower body strength, we work on mobility, we make sure that you don't get contractures, because if you don't use the limb, it actually gets tight and you cannot use that limb after that. Things like balance, people don't focus on that.
Yes.
So little things like that. We try and really work on everything holistically. Any limitation that you have, we try and address that. So that's the rehabilitation that happens at the practice. But then, once a week is not nearly enough to actually see any difference. So we do give you exercises to do at home, but we challenge you. Obviously, we make sure it's safe for you and you have things at home where it's exercising in a safe manner, but you have to do some of the stuff at home to make sure that you actually get to meeting your goals.
Yeah, and
Yes.
often what I hear from patients is they've got a high risk of falling and they've got a fear of falling.
Yes.
And exactly what you've mentioned, the balance is not always the focus. As soon as you can make certain criteria, scoring sheets,
it's done.
Everyone feels the process is finished. And again, it's quite heartwarming to hear that there's help out there. People don't have to struggle, don't have to get back into the wheelchair. And there's actually someone who can help them.
Yes, we want to help. And just another note on the balance aspect is every amputee says that you should fall. Falling is good in the beginning because you're scared to fall, and they actually tell you, the prosthetist and those people, they tell you don't fall because you may be going to break the prosthesis. But it's good for you to fall and to make sure that you can actually stand up again and you have that balance, but then you need to make sure that you fall less. Right? We need to work on that. So, but yeah, that's a very good thing to work on.
Labarre, I think a final question. You've worked with these people now. What is the greatest barriers or obstacles they face in their rehabilitation?
Firstly, I think it's from getting from point A to point B. So that transition of making that choice of I'm out of hospital, maybe the wound is healed, but what now? What do I do with my life? So I think that's the first obstacle. The second one is the psychological aspect. I feel draws people back. They become isolated. They don't go back to their previous life. Maybe they were running. They stop running. They stop socializing. So I think the psychological aspect is actually a big thing, and it's not getting addressed. There are groups out there, support groups that people can go to, but sometimes they feel it's boring, or they have to listen to other people's problems and they have so many of their own. So what we try and do here as well is use exercise to boost your mood, to make you socialize in your exercise environment. Even if it's with that one patient, your biokineticist, or with the patients walking in and out, you see another amputee, maybe you guys become friends. So it's that whole psychological aspect that we do try and address. And I mean, everyone who exercises knows that exercise is good for the mood, it's good for your mental wellness, it can only help the psychological aspect of everything.
No, brilliant, brilliant. Labarre, thank you for talking to us. Thank you for educating the people, and I think it's a great way that we can just get it out there.
Yes, thank you for inviting me.
Pleasure.